Good afternoon, guys. Welcome to episode 71 of ADHD Tiny Superpower Knowledge. Today's topic is on ADHD dopamine in depth. I previously mentioned a lot about dopamine and almost every single episode. So I hope you guys were listening to this. And, it'll get harder and harder as the episode goes. So let's start. ADHD and dopamine. Despite their names, stimulants don't work by increasing your stimulation. Rather, they work by increasing levels of certain chemical neurotransmitters in your brain called dopamine and norepinephrine. These neurotransmitters play an important role in your ability to pay attention, think, and stay motivated. So what is the mechanism of action of a stimulant? The general mechanism of stimulants revolves around increased catecholamine levels and increased agonistic activity at adrenergic receptors. Caffeine has a unique mechanism as a stimulant as it works as an inhibitor at the adenosine receptors. How do the stimulants affect cognition? Psychostimulants such as amphetamine and methylphenidate are a class of medication commonly used to treat ADHD. Psychostimulants are reported to enhance prefrontal cortex cortical-dependent function, such as cognitive performance, improve memory, as well as attention. A stimulant use disorder changes a person's brain in two ways. One is neurotoxic, by affecting the brain processes such as memory, learning, and other cognitive functions. The other way is by triggering the addiction process, such as by acting on the brain's reward system or through the development of craving. This information is critical for clinicians to understand because it explains the course of symptoms and recovery and underscores how difficult it is to quit using or misuse substances without interventions. The reward system or positive reinforcement is extremely important in ADHD. And it has to do with dopamine in every single way. Since dopamine produces a reward feeling, ADHD needs that in order to thrive. So, let's go. The brain circuit that considered essential to neurologic reinforcement is called the limbic reward system, also called the dopamine reward system or the brain reward system. This neural circuit extends across the ventral tegmental area, the nucleus accumbens, and the prefrontal cortex. Substances of misuse, including stimulants, affect the reward system. Normal functioning of a brain's circuitry result in inhibition and stimulation of neurotransmitters and multiple sites of brain's reward system. However, neuroadaptation and neuroplasticity that occur when substances are present can result in multiple neurotransmitters disrupting the normal circuitry, resulting in prolonged phase of withdrawal, negative effect, and anticipation of craving afterwards, such as if you're doing cocaine, meth, that's going to cause that. The neurotransmitters, dopamine, which helps to regulate the feeling of pleasure, is both directly and indirectly affected by stimulants. Dopamine also plays an important role in the control of movement, cognition, motivation, and reward. In addition, stimulants causes the brain to release norepinephrine, I can never say that word, which helps regulate the mood, attention, learning, memory, and arousal, and may play a role in substance withdrawal. The neurotransmitter serotonin affected reinforcement, motivation, learning, and memory, and may play a role in SUD, which is substance use disorder, by making people more susceptible to compulsive behavior. As dopamine level subsides, so do the feeling of pleasure. But if the activity is repeated, then the dopamine is again released, and more feeling of pleasure and euphoria are produced. ADHD needs that reward system in order for us to function. The release of dopamine and the resulting pleasurable feeling positively reinforce such activities and motivates the repetition of these activities. Moreover, with substance abuse, the person needs more and more of the substance to achieve the same level of pleasure. Dopamine travels across the synaptic gap until it reaches the postsynaptic neuron. It then binds to the postsynaptic neurons' dopamine-specific receptors. I wish I can show you guys the picture, but the binding of dopamine to the receptor has an excitatory effect that generates an internal electrical signal within a neuron. However, not all of the released dopamine binds to the target neuron's receptors. Extra dopamine may be chemically deactivated, or it may be quickly reabsorbed by the presynaptic neuron through a system called dopamine reuptake transporter. Dopamine is believed to play an important role in reinforcement of motivation for repetitive actions. An increasing amount of scientific evidence suggests that neural adaptations to the reward and stress system play a considerable role in the development of compulsive use behaviors. There we go. So if you guys have any questions, feel free to comment. And like I said, I'm not a doctor. Even though I was born in a pharmacist family, I do have knowledge of these. So correct me if anything that I said is wrong. Thank you very much for watching again. And next time, welcome to episode 72, ADHD and White Matter. See you next episode.